Hi, welcome back. My name is Dr. Chen Yiming. What is one of the most common cause of a painful swollen big toe in a guy? Yes, you guessed it. Gout. What do you know about gout? Review your knowledge with me in this video. And if you're new to the channel, click on the subscribe and notification button now. Gout is a very common form of inflammatory arthritis that can result in painful swollen joints involving usually 1 to 2 joints of the lower limb each time due to deposition of uric acid crystals into the affected joint. Do remember that it is a long-term condition with recurrent episodes of sudden pain in the joint. It most commonly affects the big toe and large joints in our lower limbs like the ankle or knees. Now, we can't talk about gout without first discussing purine and uric acid. So what is purine? Purines are molecules made out of carbon and nitrogen atoms, and these molecules are found in our own cells, DNA and RNA. How do we get purine in our body? 2/3 of purine in our body is due to the natural death and breakdown of our body cells, while the other 1/3 are from our diet. Food high in purine contents include red meat, animal innards like liver, seafood like anchovies, sardines, mussels, scallops and tunas, alcoholic beverages, especially beer, food and drinks sweetened with fruit sugar called fructose. Purines have to be removed from our body by breaking it down into uric acid and finally removed through our kidneys and livers through urine and feces. So what causes gout? Gout occurs when uric acid crystals accumulate in your joint, causing inflammation and intense pain. Uric acid crystals can form when you have high levels of uric acid in your blood due to high levels of cell breakdown or when there is excess ingestion of purine-containing food. Initially, gout attacks usually affect one joint with complete resolution of symptoms between attacks. But at the later stages, gout attacks can affect multiple joints, including those of the upper limbs, with the frequency of attacks increasing. So who are at higher risk of getting gout? Men are at a higher risk than females. And gout tends to happen to adults in their 30s with increasing risk with age. Patients who are obese with metabolic syndromes has a higher risk too. Those with family history, patients who are taking diets very high in purine, patients who are on certain types of medications such as aspirin, hypertension medications like diuretics, ACE inhibitors and beta blockers. How do we diagnose gout then? Gout can be diagnosed through a combination of typical symptoms, lab tests including blood tests and joint fluid analysis, and typical X-ray findings. Symptoms-wise, patients often develop 1 or 2 joint pain and redness and swelling, usually involving the lower limbs. The most common joint to be involved is the metatarsal phalangeal joint of the big toe. They often describe the pain to be of a rapid onset, usually coming on within a day or two, as intense and affecting their walking. These joint pains come and go. In fact, some of my patients even tell me that they can anticipate the onset of the arthritis just by the feeling of the impending joint inflammation. Of course, in chronic patients, some of them develop these tophi, which are chalky deposits of uric crystals in the skin. Typical X-ray findings of the affected joint includes subcortical cysts without erosions, punched out or rat-bitten erosions of bones. And if we can draw out the fluid between the swollen joint and send it for microscopy analysis, then diagnosis can be achieved by visualizing the uric acid crystals through a polarized light microscopy or not seeing any bacteria within the fluid to indicate an infective cause for the swelling. Having an elevated blood level of uric acid levels can also be helpful for diagnosis. However, there are many patients who are suffering from gouty arthritis with normal uric acid levels. So once diagnosis has been achieved, we can then proceed to treat the patient. In the acute stage, when patient is suffering from pain, treatment of the arthritis involves resting of the joint, adequate hydration with a lot of plain water, anti-inflammatory medications like NSAIDs and COX-2 inhibitors, sometimes even steroids, and colchicine. But what would make the biggest difference, however, is the long-term management of gout. It would involve a holistic management that often includes lifestyle changes, dietary changes, reduce your intake of purine-rich animal protein like beef, lamb, pork, and innards. Reduce intake of shellfish, tuna, sardines, anchovies. Reduce intake of alcohol, especially beer. Reduce intake of fructose, sweetened food and beverages. Take more plain water. Unsweetened coffee and tea can be taken as well. More fruits and vegetables. These do not cause gout. Low-fat or no-fat dairy products are suitable too. 2. Getting physically active and losing weight. This can help with obesity, which is a risk factor for gout. Exercise and losing weight can help reduce the inflammatory state of the body and helps in building strong joints as well. 3. Medications. In patients with long-term gout that has high uric acid levels in their blood with frequent gout attacks, medications like allopurinol and febuxostat can help in reducing the levels of uric acid and therefore help in reducing the frequency of the attacks. Gout is a very common and very painful condition. A lot of these symptoms can be avoided through lifestyle changes. Thanks for watching till the end. Like and share this video with your loved ones. Till the next time, stay safe and stay healthy.